Turn to question 11, and I call on the Honourable Member for Douglas South, Mrs Christian.
Thank you, Mr Speaker. I'd like to ask the Minister for Health and Social Care how long a person had to wait from a first appointment with their GP to receiving treatment from a mental health professional in each of the last 4 years, and how this compares with waiting times in the United Kingdom.
Call on the Minister for Health and Social Care to reply.
Thank you, Mr Speaker. The Department of Health and Social Care has not historically collected waiting time standards from first appointment with their GP to accessing mental health services, so we're not able to compare directly with waiting times in the United Kingdom. Data relating to maximum waiting time for follow-up post-psychiatric inpatient discharge has, however, been collected on a monthly basis since April 2017. The Isle of Man target has been 5 days maximum waiting time, which was reduced to 3 days from September 2020, compared to a 7-day target applied by the English NHS. The Isle of Man yearly average percentage compliance since April 2017 has been as follows for post-psychiatric inpatient discharge follow-up. So 2017-18, 80.25%, 18-19, 86.5%, 19 to 20, 79.9%, March 2020 to August 2020, 98.4%, and since September 2020, Mr Speaker, when we introduced the 3-day follow-up target, it has been 100%.
Supplementary question, Mrs Christian.
Thank you for those statistics. It's very rewarding and very positive to see that increasing up to 100%. The Chief Minister said in his address to the nation last week, the mental health of our nation has been put under extreme strain. Can the Minister give us assurances of what steps or strategies been taking to maintain these waiting times? And also, in light of the Chief Constable's report, can the Minister comment on persons using the police mental health professionals by being sectioned under the Mental Health Act, possibly as a quicker route to shortcut waiting times to see a mental health professional?
Minister,
thank you.
Thank you, Mr Speaker. I wouldn't want people to be sectioned as a way of shortcutting waiting times. Sectioning is a very defined legal process, and there for a very, very good reason. I don't think it's there to actually try and move things along. I think that would be an abusive process in relation to sectioning. In relation to the engagement with the police, I fully endorse everything that was said in the Chief Constable's report. I'd like to thank the police for working with us to ensure that this service could be put in place. It's been running for, I think, 2 years now, and it has been highly successful having that engagement, and it has actually, in many cases, stopped things escalating and going further, having those mental health professionals on the ground. In relation to access of services and the comments in the Chief Minister's State of the Nation, it is something that we're acutely aware of, both myself and the Chief Minister. It's a bit of a passion of ours around mental health. And there have been concerns that with people being separated from family, with obviously us having had the lockdown period, that people's mental health will have declined. The mental health team during the pandemic geared up to do virtual appointments with people. They were still taking referrals in. Where they were severe, they were still doing face-to-face. So mental health has been gearing up to be able to deal with this. And of course, we mustn't forget as well, Mr Speaker, it's a good chance for me to mention it again, there is also the online mental health support that people can access as well themselves to try and help both for adults and for children.
Supplementary question, Mr Hooper.
Thank you very much, Mr Speaker. I'm just curious if the Minister would be able to tell us why this waiting time data isn't available, along with all the other waiting time information that the Department publishes. It is very reassuring to hear that some of the targets he's talked about are being met quite readily by the sounds of things, which is in a stark contrast to waiting times across the rest of the health service on the Isle of Man. So I wonder if the Minister would care to comment on that as well.
Leaving out the second part, the first part, I'll allow the Minister to reply.
Thank you, Mr Speaker. I'll go with your guidance. In relation to this, I've said in this honourable House and also in another place many times, one thing DHSC has not been great at over the years is collecting data. That's something we are now changing, and in fact later on the order paper, Mr Speaker, we've got the clauses stage of the Manx Care Bill in creating a separate arm's length body, and one of the integral things of Manx Care will be to be able to collect measurable data. Mental health has been no different in areas of that. The data sets collected over the years have changed, which means that they're not necessarily comparable, but we are now building up a bank of data, not just around waiting times, but also different elements of service delivery, so that we can have that robustness of data and that transparency for people to be able to see where the services are going forward, and that includes mental health.
Supplementary question, Mr Shimmons.
Thank you, Mr Speaker. I was slightly surprised by the percentages which were quoted by the Health Minister. And actually, of course, they don't actually relate to the question that was put. And so just to build, because they're for discharge follow-ups, and many of my constituents are very concerned about the long waits to see a mental health professional in their time of need. So to build on my honourable friend Mr Hooper's question, why is the length of time that people are waiting for mental health support not being measured? When will this start to be measured, and when will it be published? I mean, why do we have to wait for Manx Care? This should be a key metric for our health service.
Minister to reply.
Thank you, Mr Speaker. It is a key metric. I fully agree with Mr Shimmons, and that's why the data is starting to be designed and collected. But in order to have the question was about comparison with the United Kingdom, and in order to have something to compare, you've got to have robust long-term data. That long-term data does not exist at the moment, Mr Speaker, but that is why across all of our services, so it's not just mental health, we are looking to build that robustness in, so we do have the transparency, we do have the comparators, and as I said in my original answer, we actually will have an opportunity to be able to compare.
Supplementary, Mr Shimmons.
Thank you, Mr Speaker, and I'm grateful for the Health Minister's response. I'll still go back to my original question, is why do we have to wait for Manx Care? Why can't we do this more quickly and start publishing this information monthly, so there is some transparency about the long waiting times in our mental health service? Thank you.
Minister to reply.
Thank you, Mr Speaker. I don't remember actually recollecting saying we did have to wait for Manx Care. I actually stated that the Manx Care Bill is later on the agenda, and one of the things that Manx Care will be doing is introducing systems around that, but we are already, in relation to mental health, looking at what we can do to be able to get those systems in place, to be able to record waiting times so that we can publish them as soon as the data is available.
Supplementary question, Mr Peake.
Thank you, Mr Speaker. Would the Minister agree that there are other alternatives rather than just going to the mental health service? And I think the term that's used in the department is community treatment. There are a number of outlets, and it'd be great that if the department would actually work together with these, would the Minister agree that that is the future?
Minister to reply.
Thank you, Mr Speaker. I'm most happy to agree with my honourable colleague for Douglas North, Mr Peake. We have some fabulous community organisations out there, and I'm a very firm believer, and again we'll be talking about this I'm sure when we discuss the clauses of Manx Care, that we shouldn't be thinking we can do everything from the centre. We should be engaging with community organisations. Many of them are closer to the people on the ground, and they're also able to respond a lot quicker to the needs of individuals as those needs adapt and change. So I'm more than happy to agree with my honourable colleague, and that is most definitely something the department needs to drive forward.
Final supplementary, Mr Shimmons.
Thank you, Mr Speaker. I'm delighted to hear from the Minister that the Health Service is collecting the data and that we don't need to wait until Manx Care. What I didn't hear was when that data will start to be published, and I'd be grateful if we could advise that, given the seriousness of the issues that people are facing and the importance that honourable members are placing on this matter. Thank you.
Minister to reply.
Thank you, Mr Speaker. As soon as it's in a format that's able to be published, it will be published.